So today we'll start off with drug dependence. Drug dependence, the rational use of drug, and if possible, we'll also discuss what is development of new drug, how it is drug dependence. Now, essentially, drug dependence. There's a lot of terms that there are a lot of terms that are thrown around, thinking that it is dependence. Misuse of drug or abuse of drug. वो पूरे को drug dependence है categorize करते हैं, but it is not. Drug dependence essentially is a compulsive disorder where a person who is dependent on the drug needs to take a drug. Okay, and they take the drug despite knowing that there are associated risks with it. So let's suppose someone is abusing maybe opioid antagonist, opioid drug. ठीक है, opioid analgesic को कर रहा है जैसा morphine है, okay, और some other drug like that, पिथिडीन है या मेथाडोन है या कोई भी ऐसा ड्रग है जिससे आपको नशा कर सकते हैं. Okay, so they know the risks associated with it, and despite that they are taking the drug, so that will be categorized as drug dependence. Now you will have two types of drug dependence. They can be either physical dependence or psychological dependence. Okay. Now, psychological dependence will essentially be, they are compulsively seeking the drugs. Okay, their their behavior changes whenever they are not taking the drug, and something like cigarette smoking. Okay, people who are addicted to smoking, whenever they are, off the drug or whenever they, crave a cigarette, they will have psychological symptoms. Properly, they might get irritated, and all of that will happen. Then there is physical dependence. Physical dependence में क्या हो रहा? See, whenever you take a drug, especially if you take some drug like opioid analgesic or any other drug like that, for a long period of time, your body will adapt to the presence of that drug. ठीक है? Let's suppose आप एक पेन किलर को abuse कर रहे हो. ठीक है? Let's suppose there is a drug which is a painkiller, and there is a person who abuses that. So they are continuously taking it despite knowing that it will be dangerous and despite it not being indicated. Meaning they do not need that in certain quantity. जो quantity वो उन्होंने ले रहे हैं. Let's suppose the doctor might have prescribed them 500 mg of that tablet OD. Example. ठीक है? But let's suppose they are taking 500 of the mg of the tablet TID 3 times a day. Instead of taking once a day, they are taking 3 times a day. Now, what will happen is their body will start getting used to the drug. And as soon as they stop taking the drug, let's suppose one day they go to a rehabilitation center and they stop taking the drug, or even if they simply stop taking the drug as is, they will start producing very physical symptoms. So they will have vomiting, fever, sweating. Sometimes they will have excessive appetite. Sometimes they will lose their appetite. You will see a lot of physical symptoms. You'll also see psychological symptoms associated with it sometimes. They'll become anxious or they'll become depressed. वैसा भी होता. This is more seen in alcohol या opioids या barbiturates. ऐसे drugs जो लेते लोग, ऐसे ड्रग्स को जो अब्यूज करते लोग, उनको उनके अंदर फिजिकल सिम्टम्स देखना ज्यादा कॉमन है. दे विल सी सिम्टम्स ऑफ विड्रॉल. ठीक है? सो एज सून एज यू विड्रॉ द ड्रग आउट ऑफ द पेशेंट, ओके, एज सून एज यू स्टॉप द ड्रग, stop taking the drug, or as soon as the patient stops taking the drug, they will, within a period of time, they will start having the symptoms because their body will physically start craving the drug. Okay, because their body has gotten used to the presence of the drug. As soon as you remove the drug, your body will start reacting in that way. It will go on for a while. Depends on how long they had abused that drug, depending on how much dependency they had developed to that drug, how much quantity they were taking per day, and वो बहुत सारे factors रहते हैं for you to determine how long it will take for them to completely come out of rehab and completely get off the drug. ठीक है? So but in any case, even if you are stopping it, you will see it several times. People who are dependent on drug, they will start having shivering, they will have chills, they will become very sweaty, they'll have a fever, opura hota. Okay, they might vomit sometimes, and all of that. They will have a gastrointestinal distress. Okay, क्या hota, right? Another common example of drug abuse, very common in India, is Digene, या फिर any drug that is an antacid. ठीक है? Antacid abuse बहुत common है इंडिया में. people, what they do is they carry antacid with them at all times. So antacid is something that is decreasing stomach acidity, gastric acidity. Now, once in a while, if you're taking it, that is fine. In the sense that if you severely have a problem of acidity and you're taking it at a medicated dose, that is fine. What people do is they will take Digene, या वो pink color का fluid आता. I forgot the name of the drug. It is essentially Digene. It is a different generic name. But what they do is they will abuse that. Whenever they feel slight discomfort, they'll drink it, and there is no regulation over it. So over the day they might drink a lot, and what happens is their body will start getting dependent on it. Whenever they feel slight hunger as well, if you feel hunger, you will obviously have a little bit of, it will not exactly be burning sensation, but you'll know when it is hunger, right? Because acid content in your body has increased. That is why you feel hungry. That will be a stimulus. Now, those people will mistake that as well, that as gastric stimulus as well as acidity, and they will again drink Digene. So that will create a very vicious cycle. That is another example. In those cases, what will happen is, let's suppose they stop taking Digene, their stomach acid levels will spike up quite a lot because their body has gotten used to the presence of that drug. Okay, the body is somehow functioning normally with the presence of drug. As soon as you remove the drug, that body will, it will become haywire. Things will start falling apart, and all of that will happen. So that is drug dependence. Now coming to rational drug use. Now rational drug use का मतलब क्या है? See, if you put it in very simple terms, it is just that you are giving a patient a drug which is therapeutically indicated at the correct dose, and you are monitoring the drug continuously. Once the patient has diagnosed with a particular disease, they need to be treated with particular drugs specific to that therapeutic objective. मतलब अगर patient को let's suppose आप nephritis से diagnose करें. So you need to give drugs for nephritis, or they have, let's suppose, some infection. You need to give drugs specific to that infection. Even if they are antibiotics, they need to be narrow spectrum antibiotics in the sense that specific to that organism you need to give. Okay? You need to define it properly. अगर आप let's suppose high blood pressure के लिए दे रहे, ठीक है, you need to make sure that you are giving it in time so as to avoid the complication of prolonged hypertension. If you are able to treat it in time, you will not see prolonged complications. Let's suppose someone got diagnosed with hypertension at the age of 45. Okay, let's suppose there is a person who is 45 years old and they got diagnosed with hypertension. Now, if they start taking a tablet, initially what will happen is, let's suppose they have a blood pressure of 140 by 90. Okay, stage 1 hypertension. So slightly below stage 1 hypertension. Pre-hypertensive भी बोल सकते हैं. I'll discuss about what are the stages of hypertension some other day, but this is a pre-hypertensive stage, or sometimes it will be classified as the stage 1 as well. Anyway, it is slightly higher than normal. So अगर यहाँ पर आप see, in such patients, one of the best things that you can do is prescribe lifestyle modification. So let's suppose they are working in a very stressful environment, you will advise them to take steps to decrease their amount of stress. So maybe go for a walk, do meditation, or whatever they feel, do anything that relaxes them. Okay, it might be any other hobby that they have as well, whatever it is, spending with time with their family or whatever XYZ they are doing, and maybe decrease their body weight a little bit. That is very important, especially people who are severely overweight and they are having pre-hypertension. If they even decrease their body weight by about 5-6 kilos, there'll be a significant decline in their this thing, blood pressure. 5-6 kgs of fat mass. I'm not telling 5-6 kg of body weight. ठीक है, आप खाली पानी नहीं पी के भी 5-6 किलो उतार दे सकते हैं, but that is unhealthy, and people will go crazy with that kind of advice. So 5-6 kgs of body fat, if you are able to decrease over a period of time gradually, then you'll definitely see improvement in general health as well, and you will see improvement in the person's blood pressure as well. अब अगर आप ये पॉइंट पे छोटी ड्रग लेना स्टार्ट कर दिए ये पेशेंट, सी वन थिंग अबाउट हाइपरटेंशन इज दैट वंस यू हैव इट, you need to continuously take the drug, and it is not something wherein you take the drug once and once blood pressure falls you stop taking the drug. It is not like that. It is something like asthma. Once you are on it, you are always on it. ठीक है, आप छोटा डोज भी ले रहे हो रोज लेना ही पड़ता. However, it is indicated for you. You cannot get up one day and say, okay, my blood pressure is normal today, I will not take the drug. So that will be a problem. Once it might be fine if you forget it one day or something like that. But if you continuously keep doing that, that will be a problem. Okay. So once your objective is clear, the choice of drugs should be made. Okay. आपका objective in the sense from a nursing perspective, let's suppose, is to treat hypertension. You are choosing a few drugs. Okay. Several aspects will be considered when you are choosing the drug. ठीक है ये स्पेसिफिक कंडीशन के लिए वो पर्टिकुलर ड्रग अच्छा है क्या पेशेंट कोई और कोमॉर्बिडिटीज does the patient have any other comorbidities or maybe the patient is not able to afford the drug. I'll give you another example. Let's suppose someone has hyperacidity. ठीक है someone has hyperacidity. So in case of hyperacidity and mild gastritis, it can be managed by antacids. You can give simple antacids, मिल्क ऑफ मैग्नीशिया या वो पूरे दे सकते हैं, एल्यूमिनियम हाइड्रोक्साइड. अगर एंटासिड्स काम नहीं कर रहे, then you give a H2 blocker like ranitidine. ठीक है. Even if ranitidine does not work, in the more severe cases, that is when you give omeprazole. Now what happens is, this is the rational use of drug. तो आप पहले mild treatment try करके देखें. You have tried the milder treatment, then moderate treatment, then you went to the last stage of treatment. You do not directly go to omeprazole. Okay, if a patient is coming to you with hyperacidity and mild gastritis, you do not directly go to omeprazole. Okay, you go in succession until and unless they are a hospitalized patient who needs to be stabilized immediately. Maybe then you go, but generally no. Especially in OP patients, उन लोगों को पहले antacids दे के try करते हैं. Then if that is not working, you try ranitidine. If that is not working, again omeprazole. And during this time, you will advise them to, try other methods as well. Drugs is not the only way to treat gastritis. Maybe you ask them to eat less spicy food and take other objectives. Eat less fatty food. Maybe go for a walk. Things like that. Okay, those things help. Now, patient factors will also have to be taken into consideration. What is the age of the patient? Okay, presence of other diseases. How is their renal and liver function? What are the other drugs that are being prescribed to the patient other than this? If they have some other condition as well, if they are being given those drugs, will these drugs, interact with those drugs? Will there be any reaction altogether? You have to take that into consideration. And cost of therapy as well. Okay, generally speaking, newer drugs and newer branded drugs will be more expensive. So especially in a country like India, developing country like India, most people will not be able to afford expensive drugs. Okay, and it will become a big burden on their family and on them as well, just to for you to prescribe any expensive drug. And let's suppose it is a hypertensive drug that they have to take every day. Okay, in that scenario, it will become a problem. So you generally try with older drugs. If those are not working, then you go to newer drugs. But you always leave that option. Start off with the cheaper ones, then go to expensive ones if it is not working. Okay. Try several alternatives as well. Nowadays, generics भी बहुत सारे आ रहे हैं. You will get a lot of drugs. I'll give you one example. There is, I'm not sure, in Hyderabad itself, there are a few commercial hospitals who sell an injection of Magnexfort. So there is one particular injection called Magnexfort. It is an antibiotic. Cefoperazone है ये. ठीक है. Cefoperazone sulbactam का combination है. This injection is sold in the hospital for around, I'm not going to reveal what hospital it is and what it is, but this injection goes for anywhere between 3 to 6,000 depending on the dose. Okay, a single injection. If you go outside to a pharmacy and you buy the generic of that same drug, okay, same Magnexfort, same combination, and if you buy it in a generic store, you will be able to buy it within 2 to 300. ठीक है, उतना डिफरेंस आया था, almost 10 times difference. Okay, so that will make a big difference on the patient's condition, financial condition as well. So you have to take everything into consideration in that, from that point of view. That will also be categorized under rational use of drug. Okay, you're not just mindlessly spending money, or you're not just mindlessly prescribing drugs. The dose and duration of the treatment is also very, very important. You have to make sure that the dose you are giving to that patient, they'll be able to bear that dose, and you're distributing the dose throughout the day properly. Sometimes you will see improper combination of drugs as well. Okay, silly combinations that pharmaceutical companies come up with. For example, let's suppose ibuprofen and paracetamol का एक combination बनाया था. ठीक है. Ibuprofen is a this thing NSAID drug plus paracetamol. Both of them are NSAIDs, but the problem is that both of them do the same function. Okay, you can give either of them. You do not need to give a combination. It serves no purpose altogether. So you definitely find brands that sell a combination of ibuprofen and paracetamol. They essentially do the same function. It is pointless to give two different drugs to the patient. Okay, you're simply increasing the price and you're simply increasing the chances of getting ADRs. Okay, it is not even like they have synergy or something. ठीक है, खाली एडिटिव इफेक्ट, वो भी आप यूजलेस एडिटिव इफेक्ट यूज कर रहे हैं. ठीक है, या फिर आप थोड़े एंटीबायोटिक्स रहते हैं, एंटीबायोटिक कॉम्बिनेशन, फॉर एग्जांपल देयर इज amoxicillin and cloxacillin. Amoxicillin 250 mg plus cloxacillin. This is also 250 mg. Now this combination is also available. Now these two drugs are type of penicillins. Okay. Now cloxacillin is a drug that can destroy penicillinase producing staph aureus. Okay. Penicillinase बोल के एक enzyme रहता. Now some bacteria are very smart. After a while, let's suppose somewhere around 1940s, 1950s, when penicillins were started to being distributed quite a lot, ठीक है, वो टाइम के बाद क्या हुआ, these bacteria started to develop resistance. One form of resistance was that they were developing an enzyme. The bacteria itself was evolving in such a way that it started producing an enzyme called penicillinase. That penicillinase enzyme can destroy penicillins. Okay? So I'll repeat once again. Initially, in the earlier days, when penicillin was the only proper antibiotic which was available and people were using it quite a lot, bacteria were definitely being killed. But after a while, what happened is bacteria themselves started to get evolved and they started developing resistance. One such form of resistance was that they were developing an enzyme, they were producing an enzyme that could destroy penicillins. You get the conventional penicillin, penicillin G. That enzyme was penicillinase. One such organism that did that was Staph aureus. Okay. So Staphylococcus aureus, that particular type of strain is called PPSA, पेनिसिलिनेज प्रोड्यूसिंग स्टैफ ऑरियस. ठीक है, अब पीपीएसए को काउंटर करने के लिए आप क्लॉक्सासिलिन दे सकते हैं. क्लॉक्सासिलिन इज अ टाइप ऑफ पेनिसिलिन दैट इज रेसिस्टेंट टू पेनिसिलिनेज. It is a special type of penicillin that was developed, synthetic penicillin, just so that if an organism produces penicillinase, it will be able to act on that. Okay. Now, if PPSA is the organism that is affecting the person, see, आप क्या कर रहे हैं? Amoxicillin 250 mg दे रहे हैं, cloxacillin 250 mg दे रहे हैं. Let us suppose PPSA is the organism that is causing the infection in that patient. 250 mg is a very low dose of cloxacillin. It will not work. It will not give proper. It will almost go into subtherapeutic doses. It will not achieve proper effect inside the patient. Okay. If it is not PPSA, then amoxicillin is the underdosage, 250 mg. So you can see that this combination is completely useless. यहाँ पर क्या कर रहे हैं आप? अमोक्सिसिलिन दे रहे हैं, क्लॉक्सासिलिन दे रहे हैं. ठीक है, एंड यू आर होपिंग टू ट्रीट पीपीएसए, पेनिसिलिन प्रोड्यूसिंग स्टैफ ऑरियस. If it is actually PPSA, cloxacillin is underdosed. Cloxacillin should be more than 250, and you only need to give cloxacillin. You don't need to add the amoxicillin. Amoxicillin will be useless. अगर PPSA नहीं है तो cloxacillin की जरूरत नहीं है, and because it will be useless, and amoxicillin is underdosed in that scenario. So you can see this combination is very, kind of useless. तो आप कोई proper purpose serve नहीं कर रहे हैं, and you are unnecessarily giving extra drugs to the patient, and you are increasing the price of that single dosage as well. आप एक एक ड्रग जो दे रहे हो उसका प्राइस पे करना ही पड़ रहा है ना उनको. तो यहाँ पर this is clearly irrational use of drug. So those all things you have to keep in mind when you are thinking about rationally using drugs. All right, rationally prescribing drugs or rationally distributing drugs. And so that completes our rational drug use. Now, finally, we'll come to drug development process. If you have doubts till now, if you want me to repeat something, please feel free to ask. So this is the drug development process. So क्या होता, let's suppose someone is developing a drug from a synthetic base. Okay, initially they will perform certain research, okay, basic research on a certain compound. Okay, let's suppose synthetic base is जा रहे हो ना, they find let's suppose a scientist invents a compound or discovers a particular compound in some other thing, and they perform basic research. Later on they find out, okay, this particular synthetic compound is having a certain effect where it is decreasing body temperature, or it seems that it might decrease body temperature. That will be the early discovery. Okay, wherever you try to test it in the lab, it will show that that drug is having the effect of an antipyretic drug. Okay, it will work something like paracetamol. Let's suppose you as a scientist are able to find such a कंपाउंड, ठीक है। आप क्या करते हो, उसमें प्री क्लिनिकल स्टडीज करते हो। प्री क्लिनिकल स्टडीज में आप क्या कर रहे हैं, यू आर टेस्टिंग दैट कंपाउंड ऑन एनिमल्स। So during this period of time, you will be able to adjust what is the dose that can be given, what are the general PK/PD parameters. थोड़ा idea आने लगता है आपको। And if I slightly increase the dose, what will happen? If I slightly decrease the dose, what will happen? ठीक है। This will be done. Preclinical studies will be done in animals. तो आप क्या करें, पहले basic research कर रहे हैं। You are trying to find out whether or not one particular particle of chemical or maybe some let's suppose some compound that you got from a plant has certain effect, and let's suppose you get a discovery that this particular compound has an antipyretic effect. You perform that study in animals, generally rats पे या इस पे क्या बोलते हैं rabbits पे या monkeys पे करते हैं, ठीक है। Once you have done your preclinical studies and they are clear, they go into clinical trials, ठीक है। That is the clinical development stage, ये वाला they go into this, ठीक है। Now यहाँ पर human testing होती है। Preclinical will be pre-human testing, second stage will be human testing, ठीक है। Now generally speaking, from the point of basic research to preclinical, it takes about somewhere between 3 to 10 years, ठीक है। It can be lesser, it can be more as well. It can be fewer number of years, or it can be more as well. But generally, 3 to 10 years is a good ballpark. Then comes into human testing. Human testing में क्या करते हैं, 3 अलग trials में phase 1, phase 2, phase 3 trials करते हैं, ठीक है। Technically this is named phase 4 trials, post marketing surveillance trials को phase 4 बोलते हैं, but we'll get to that when we get to that. Human trials में क्या करते हैं, you are giving the drug which you found in preclinical studies. Let's suppose you identified some drug. Let's suppose it's the name of the drug is A, and you found that 30 mg is a decent dose to give, ठीक है, and you have some idea what that drug will do. तो आप क्या कर रहे हैं, phase 1 trial run कर रहे हैं। phase 1 trial में आप क्या करते हैं, you will select about 20 people, 20 to 30 people, and you will administer the drug, ठीक है। ये हेल्दी पेशेंट्स में दे रहे हैं आप, ठीक है, हेल्दी पीपल में दे रहे हैं, इन लोगों को कोई प्रॉब्लम नहीं है सच, एंड आप देख रहे हैं ड्रग का इफेक्ट क्या है। Let's suppose you find that the drug is performing as you thought it would, and it is showing the effect that you thought it would. You will move on to phase 2 trials. Phase 2 trials में क्या करते हैं, you go into hundreds of population. So from 2030 you go to about 200. यहाँ पर 200 people में, and 200 people will be diagnosed with that particular condition. So let's suppose your drug was a drug which decreased body temperature. तो आप क्या करते हैं, you take 200 patients with fever and you give that drug. अब इसमें आप clearly what is the proper dose, what is the highest dose that can be given before toxicity occurs, what is the minimal dose that can be given before it stops showing any effect, वो पूरा डिटरमाइन कर दे। इसके पीके/पीडी पैरामीटर्स थोड़ा गेज होने लगते वो डोज पे, ठीक है। अब पीके/पीडी ये डोज पे तो करे थे, अब यहाँ पर जो ह्यूमंस पे डोज आप दे रहे उसके क्या पीके एंड पीडी पैरामीटर्स है वो थोड़ा मालूम होने लगते। Then if it is working in phase 2 trial, you move on to phase 3 trial. Phase 3 trial में you go to a bigger population. So from 200 it will go to, let's suppose, 2000 to 3000, 2 to 3000 people, ठीक है। Slightly bigger, considerably bigger population, ठीक है। These will also be people who are affected, ठीक है। In this you will try to include more diverse people. So let's suppose आप 2-3,000 में से मे बी थोड़े इंडियंस को ऐड कर रहे हैं, थोड़े मे बी इंडिया में ही कर रहे हैं समझो ट्रायल। तो यू ऐड पीपल फ्रॉम दिल्ली, यू ऐड पीपल फ्रॉम साउथ इंडिया, यू ऐड पीपल फ्रॉम ईस्ट इंडिया, वेस्ट इंडिया। आप थोड़ा डाइवर्स करने की कोशिश कर रहे हैं, इफ पॉसिबल दैट इज। But essentially, you take 2 to 3,000 people who are diagnosed with a particular condition of fever, and you try to give that drug. Okay? And in this, you will confirm the PK and PD parameters of the drug. You will pakka decide the dose. Okay, this is the safe dose for a patient, and you will clearly able to define. Okay, these are the PK parameters of the drug. These are the PD parameters of the drug. Once a drug passes through phase 3 trial, okay, and it has worked in most of these 2 to 3,000 patients and shows promising results, that is when it will go for FDA review. FDA is Food and Drug Administration, which is present in USA. वैसा अपने पास इंडिया में CDSCO रहता है या DCGI ऑफिस रहता, वो लोग अप्रूव करते, ठीक है. So they'll be looking at the drug, they will look at the whole trial, they'll see the results of the trial, they'll study it, and after that, if they think that the drug is appropriate and okay, it can be distributed to a larger population, they will give the nod and it will pass the review. Once it is passing through the review, it will be gone into post-marketing monitoring or post-marketing surveillance. इसको phase 4 clinical trial भी बोलते हैं. Post-marketing surveillance में क्या कर रहे हैं आप? You are giving the drug to the population, to the whole population in general. So from 2 to 3,000, you are significantly increasing the population size. यहाँ पर what will happen in post-marketing surveillance is essentially कोई एक pharma company है. Let's suppose what pharma company do you know? Let's suppose there is some pharma company called Sun Pharma. Okay, some XYZ, some pharma company who produced this drug. Okay, generally these trials are funded by pharma companies. So now that pharma company has produced that drug, what they will do is they will send their representatives, their marketing people. They will teach those marketing people the details of the drug. See, this is the drug. It will do this. These are the side effects, and these are the doses that can be given. These are the indications. These are the contraindications. Contraindications will essentially be आप वहाँ वो condition में नहीं देना. So let's suppose contraindicated in pregnancy बोले, तो pregnant patients में बिल्कुल भी नहीं देना. या contraindicated in children भी है, तो नहीं देना वैसा. So you will give contraindications and everything. That will be explained to doctors. So they will go to different clinics, they'll go to different hospitals, and they will market the drug. Okay? They'll give samples of the drug for free, and they will market the drug. And they will also tell the doctor, if you see any particular response from the patient that is abnormal, okay, other than normal, which I've already told you, please report it to me and please report it to the organization. Okay? That will be post-marketing surveillance. So आप एक बार market करके drug के now यहाँ पर 2 to 3,000 people ही लिया आप. You cannot possibly hope to include all genotypes, all phenotypes, all different people from different walks of life. ठीक है? तो यहाँ पर जब आप post-marketing surveillance करते, you are including a much larger population, 30, 40, 50 lakh people. So in that you will see several different type of people who have maybe some certain genetic disorders, or maybe they have diabetes or different comorbidities. You'll be able to find out this drug, how is it acting in different people. So you will monitor that as well. Okay? Generally speaking, post-marketing surveillance goes on for about 6, 7, 10 years and 15 years as well. The whole process from drug discovery यहाँ से यहाँ तक takes about 20 to 25 years. The whole process from basic research till the point where it is going out into the public. So let's suppose nowadays, right now in 2021, you see a drug that is coming out, latest drug. Let's suppose it is a new drug. I'm not telling a copy. Generic drug nahi bana rahe. It is a new drug. Generics ka zara alag rehta funda, but it's a completely new drug. That drug, more often than not, what happened is it was discovered in the 90s and the research started in the 90s. Now it has been, distributed into the populace, general populace, because it went through clinical development. Agar generic drug hai, meaning there is already a drug, there is a company who had already made a drug. Ek paracetamol already ban gaya. API is already safe, we know that. Some other company wants to make a copy of that drug by changing the formulation and implement. ये पूरा स्टेप स्किप हो जाता. जो अर्ली डिस्कवरी प्रीक्लिनिकल वो पूरा करना नहीं पड़ता. You simply change the formulation and clinical trials में directly चले जाता. And it will be much more shorter as well. Generally only excipients ही add कर रहे हैं आप. More often than not, you will not see a lot of problems. If you do see as well, you will be able to find out within the clinical trials itself. Okay, so the total number of time that it is spending in the lab being tested will be cut down quite a lot. So generic drugs take less. They might take about 4 or 5 years or 10 years as well. Within 5 to 10 years, they'll come out. Okay? Generic. Agar original drug hai, new drug hai, then it will take around 20 years. 15 to 20, 25 years as well. That is the whole process of drug development. If you have doubts, please feel free to ask. Want me to repeat any stage of this drug development process? Okay.